I did the drug Cisplatin for it's used in cancer therapies. It's actually used to treat many cancers of originally the testes. It's also been used in the ovaries, bladders. It's also combined with other therapies several times to cure other types of cancer. So for the mechanism of action, cisplatin is actually a DNA damaging agent. So if you can see it, it's actually right here in the middle of this diagram, the little squares. You can see that it's going to go down and it actually causes damage to the DNA in the nucleus. It then causes the cells to arrest in the G1, S, or G2 phase. It then attempts to repair this cell damage. The repair ultimately fails and the cell will undergo aberrant mitosis followed by apoptosis. The apoptosis pathways converge on common irreversible execution phases where the protease and nucleus digest the cell. Factors that play a role if the cell lives or die actually include p53, tumor suppressor, BCL2, and which are the family proteins. Activity of cisplatin can be enhanced in actually preventing cell cycle arrest. So there's a lot of side effects of this drug. Some are very serious and some are just some common ones that actually occur quite frequently. These include nausea and vomiting, loss of appetite, joint pain, loss of balance, swelling of feet and lower extremities, ringing of ears, and some fatigue. Serious side effects that they say, of course, if these occur, you should consult your doctor immediately. These include seizures, loss of taste, loss of reflexes, trouble walking, muscle cramps, painful urination, which could include blood in the urine as well as the stool, and slurred speech. Cisplatin has actually been found to cause serious kidney problems, nephrotoxicity, especially in elderly patients. That's one of the major concerns of this drug being used, as well as serious hearing loss in children. So a history of the drug's discovery. First, it was actually discovered by an Italian chemist in 1844, and it was known as pyrones chloride then. However, Barnett Rosenberg discovered it as a cancer treatment actually by accident. He was doing an experiment basically where he found that bacteria grew 300 times its normal size. Platinum electrodes were then placed in the area and they generated an electrical field. During this time, he found that they were corroding in the solution, the electrodes, and the corrosion in the solution actually produced cisplatin. He then further tested this on E. coli cells. The cells ultimately, when they had these electrodes in there, they stopped dividing. However, they did continue to grow in size, but division did stop. He did further testing after that and discovered that cell division was not actually being blocked by the electrical field, but it was being blocked by the cisplatin. They did start doing human trials because he previously had tried it on tumors in mice. They then did a human trial in 1972 where it effectively removed testicular cancer. The FDA ultimately approved it in 1978, and it's been used ever since then. These kinds of drugs are now used in all chemotherapy treatments, about 40% of those. I did put my references here at the bottom of this page as well. And this picture right here is actually of Barnett Rosenberg. So my drug-related question, I was kind of curious about this, is that if it's possible, I'm not even sure if it is, how can they make this drug less toxic on the kidneys so it won't be so much of a threat using it in the future?